Hey, Dan from Michigan here again. I really want to go after a topic today that I've had a lot of thought on, done a lot of research on, talked to a lot of people about. And, if you're an individual, a family, a business owner, and especially if you're a senior like I am, um, or even if you're approaching retirement age, you probably noticed something unsettling about healthcare over the past few years. And Medicare supplement plans, as well as all the other insurance plans, everything seems to just keep going up and not at a normal pace, right? It's just more than what we really want to have to worry about. And so I want to talk today about an option that I think everybody should at least consider, and a specific company, especially that has really come along. They've been in business for about 6 years now, and they've really come along in being able to how do you want to say it? Transform really this whole industry, and in a way that they are growing at leaps and bounds. And many people are starting to consider this being an option. So, Medicare supplement plans keep getting more expensive. I've been looking at them and kind of like at a balance right now as to I could go that way and it would probably be about the same, but in essence, it'd probably be even less. Um, Medicare Advantage plans, they change networks, benefits, and rules all the time. Prescription costs, hopefully they'll start coming down now, but they've been continuing to go up to you. It just seems like there's more confusion, there's less certainty, and especially for seniors, doing everything right, you're staying active, you're eating well, you're taking care of your health, yet you're still paying more and more for coverage that you rarely use. But even if you are someone that is using it, this plan can be for you as well. So you don't even have to worry about what's covered and what's not covered. This is also a thing that I'll talk about a little bit more. And for many, the bigger concern isn't just cost, it's uncertainty. Uncertainty about providers, about out-of-pocket expenses, about whether today's plan will make sense next year. If it sounds all too familiar, I really want to stay up front. What I'm about to share may not be for everyone, but it's an option worth considering. It's called Impact Health Sharing. And while it's not traditional insurance, it has become a practical, really, and an increasingly popular alternative for a lot of seniors, families, business owners that really want transparency, flexibility, and control over your healthcare planning. We'd all like to have that. And I think this company kind of does it all. Healthcare sharing, it's not a new idea. It's been around for a long, long time. You've heard other companies that have, I'm sure, advertising maybe on your favorite radio station not so much on TV, but definitely on radio stations or online. It really kind of began in close-knit communities where people just voluntarily helped each other during times of medical need. Somebody faced a serious illness or an accident. Everybody in the community stepped in and shared the financial burden together. And over time, this idea has become more organized and structured, forming what we now call healthcare sharing organizations. And the core principle's always been simple. People voluntarily come to share one another's medical expenses instead of paying premiums to a traditional insurance company. And many early healthcare sharing programs were faith-based, requiring religious affiliation. They operated primarily as reimbursement systems, meaning that the members paid their bills up front and then they waited to be reimbursed later. And so that worked for some people, but it also created limitations, delays, frustrations, because not everybody has the money to pay out for those big health things. So Impact Health Sharing was intentionally designed to solve a lot of those issues. They are a nonprofit healthcare sharing organization. It's been operating for just over 6 years now and is one of the fastest growing sharing programs in the United States. They've got almost 19,000 members right now. Doesn't sound like a lot, but in 6 years, they've grown. They've got a huge cash reserve, over 10 months according to them, over 10 months of being able to pay out ahead. Okay, so that is really good. It's not insurance, but for the right person, it can function very similar to insurance in day-to-day life while really costing significantly less, especially today. I mean, insurance has gone up so much. And so it does not use a one-size-fits-all models. There's plans designed for individuals, for families, and there's a separate program specifically designed for us seniors. Each one's structured differently, and that distinction matters, but pretty cool. For individuals and families that are under 65, it serves as a primary healthcare sharing program. Members get a membership card that looks very like the insurance card. On the back is a payer ID number, which allows the doctors, clinics, hospitals, and facilities to bill Impact electronically, just like they will with the commercial insurance. And this is a huge difference from traditional health sharing programs. It's not something they have in place. I haven't found one that really, and there may be, but I haven't found one besides this one that makes it that simple. Instead of requiring members to pay everything up front and wait for reimbursement, Impact's designed so they can, providers, the doctors and that, can submit the bills directly. They're typically processed and paid quickly. Now, if you've been involved in an insurance program or understand all about the insurance industry, you will be surprised to hear that this company pays within 12 to 15 days. And this is something that doctors and other providers love, because typically insurance companies, 30 to 60 days, sometimes longer, waiting on their stuff. So it's really nice to be able to have somebody that comes around and pays right away. So it uses familiar concepts, Impact, just kind of different terminology. So what insurance calls a deductible, Impact calls a primary responsibility amount, or PRA. And this is the amount that a member is responsible for before sharing begins. So once that is met, then eligible expenses are shared at 90%. You pay 10%. So Impact shares 90%. The members pay 10%, what they call a co-share. Now, there is an important annual safeguard built into the structure, and the maximum a family will ever pay, so in a single year, is $5,000 in the co-share. So once that limit is reached, Impact shares 100% of eligible expenses for the remainder of the year. And for many families, the cap can provide clarity and peace of mind because you can budget it, right? This is the most I could have come out. And if you're able to have money saved and put aside for that just in case, great. If you've been healthy and you know that in the future you may have to, and you kind of create an account just for that, that's a good way to think about it, right? And if you hope that isn't going to happen, and you just deal with it when it comes, right? Now, for seniors, it works really differently, and it's intentionally so. It doesn't replace Medicare. Instead, it offers a senior program designed to work alongside Medicare Parts A and B. So you have to have Part A and B. So Medicare remains the primary payer, and Impact now is acting as the secondary. They're going to share the eligible out-of expenses that Medicare does not fully cover. So this could include co-insurance amounts, certain deductibles, medical costs that Medicare leaves behind. Basically how a supplement would work if you already have one. So it's alternative to traditional medical supplement plans, not as a replacement for Medicare itself. And it's priced differently than individual and family plans, and is built specifically for this role. It definitely can result in lower monthly costs. I know that for a fact. My plan right now would run me $96 a month. I'm paying $138, I believe, for my supplement right now. So the fact that I've been pretty healthy, in fact, I just had to pay a bill from last year, and I'm like, why didn't they pay this? Well, I didn't even come close to paying, having my, what do you call it? Having my monthly, my yearly plan paid out. And so I had to pay the $106, okay? And I only have a total out-of-pocket costs on my supplement of like $225, 200, maybe $240 now, something like that. But I just didn't have to use it, So, fortunately for me. But if you have, then you know exactly what this will work like. So it defines pre-existing conditions, okay, for families and individuals, and you are going to have pre-existing conditions. For seniors, there is no pre-existing condition clause, okay? So it doesn't matter what kind of health you are in, the requirement is that you have Medicare Parts A and B. So it defines a pre-existing condition as a condition where signs, symptoms, testing, diagnosis, treatment, or medication occurred within 36 months, 3 years, prior to enrollment. And so to become eligible for sharing, that condition must be sign, symptom, and treatment free for 36 months. So if you've been dealing for something with the last 3 years, and you know that it's pretty much taken care of, it's going to take another 3 years to kind of prove to them that you don't have that condition anymore, and it will not be covered during that time. So if you're even thinking, I don't know for sure or whatever, then, this may not be for you, but at least it's an option. There's no hidden interpretations or moving goalposts or surprising exclusions. Certain common, well-managed conditions such as high blood pressure or high cholesterol, they're not automatically treated as pre-existing for future events as long as they're properly monitored and maintained. So that is one thing that it does exclude. The enrollment does not require a physical exam, blood test, or blood work. So why are we different than other health sharing organizations? So first of all, there is no religious requirement. So some of the other ones, many of them have religious requirements in order to be part of that health sharing plan. People of all beliefs, backgrounds are welcome. Second, Impact is designed for electronic provider billing, not just reimbursement, making it easier for you, and for providers to work together. And then Impact actively reprices medical bills. This is huge. They use reference-based pricing to ensure members are charged fair market value, not inflated hospital sticker prices. And we all know how that works. So this often reduces bills significantly even before a member meets their personal responsibility amount. Fourth, it offers an unusual level of financial transparency. You'll have a portal that you can log into. You'll see your financial reserves, how funds are shared, administrative and program costs, community-wide sharing activity, and the level of openness really kind of gives people a peace of mind knowing that they're with something that's this transparent, okay? Now, they do have some additional benefits that matter. They include 24/7 telehealth. That's part of the service, 24/7. From people I've talked to on this, it is extremely easy, extremely quick. And how many times do we not want to have to go in for something? We can get an answer on whether it be our kids or ourselves with 24/7 telehealth. Well, you're talking to a doctor. So a free annual wellness visit, sometimes a nurse too. I have to double check on that one. Don't quote me on that. Okay. Well, we can check and find out. You get a free annual wellness visit that's paid up front. You get a $150 annual lab credit per member, and you get prescription discounts. There's got lot of generic drugs that really aren't going to cost you anything through them, or very little. And then virtual mental health services. So that's kind of stuff you'll do virtual as well. And they also have a dental and vision discount program with pre-negotiated pricing. VSP is one for their vision. I've used them to get these glasses. Actually, they were great. Okay. So these benefits apply across all programs with structure depending on whether the member is an individual, family, or senior. So those are some additional benefits, okay? It also offers a wellness rewards program. This is not for seniors, but for individuals and families. You can submit up to $150 a month in eligible wellness expenses and apply that towards reducing your personal retirement, your personal responsibility amount. The eligible expenses are chiropractic care, massage therapy, acupuncture, fitness memberships, supplements, holistic or functional medicine, direct primary care memberships. So this is really huge. You know, that's a lot of extra stuff, and that reduce your bill $150 a month. That can be huge as well. They do offer year-round enrollment, so there's no open enrollment period. Membership is going to begin on the first day of the next calendar month. So here we are at the end of the month right now when I'm filming this. You're not going to see this till February. But, you know, it's, if you were enrolled right now, then you'd be covered right in the beginning of the next month. And this way it allows people to make healthcare decisions when they're ready. So not when a deadline forces them to do that. And, you know, if you know you want to do it and you know that, you know, how much it's going to be, because you're going to know exactly how much it is going to be within about a minute, okay? And you can get some additional questions answered and find out if you already have some pre-existing conditions, take a little bit longer. So, you know, healthcare costs are rising, and many families feel trapped between paying more every year or going without protection altogether. You know, we're not talking just a couple $100. A lot of health insurance today is several $100s, if not thousands, okay? So for the right person, it can, Impact Health Sharing offers a different path. They're built transparently, they have community, and they have fairness. They actually have a Facebook page where you can interact with other people as well that are part of the community. I'll put a link in there below for that. I'll also put a link in there for their site where you can take a look at that. And you can go right on their site and get a quote like right away, especially if you're healthy. If you're healthy, boom, you're going to know right now. If you've got some existing stuff, you can communicate with them, and you'll be able to get answers. And they do have you can actually call them if you want, as well as doing online stuff, chats and stuff. And they have a bot as well that does a really good job, actually. So if you're fairly healthy, you're paying for your own coverage, or you're looking for a smarter way forward, really Impact Health Sharing is absolutely worth a closer look. And if you're a senior, it really deserves special consideration. You worked hard, you planned responsibly, you earned the right to healthcare options that make sense for this stage of life, not rising supplement costs, shrinking choices, and constant, really, uncertainty. And I think now I think it's either 2 or 3 years, they have not raised their price at all. So that tells you something about the model, how it works, because if it wasn't, they would have to raise prices as it goes up. It doesn't replace Medicare, as I said earlier, for seniors. It complements it. And for the right senior, it can be a thoughtful alternative to traditional Medicare supplement plans. Like I said, I'm right on the edge right here that if I figure it out, if I was healthy all year, absolutely there'd be no reason for me to, but if I had a lot of tests and stuff to go to, it's kind of borderline as to whether it costs me a little bit more with my supplement or a little bit more with Impact. So definitely already leaning that way. You deserve clarity, which is really great. It gives you the options of going anywhere you want. You know, if it really resonates to you, whether you're an individual, a family, if you work for a company and you'd like your company to take a look at it, you know, they'll be able to do that as well. And so then, you know, just take the next step. You can ask me questions in here. I'll get answers for you. I'm going to put a link in the site. I actually have a friend of mine that markets this, so nothing in it for me. This goes to, if you want to go through her link, you can, but you don't have to. You can just contact them. Sue's really great with people. Um, ask questions, explore with other Impact Health sharing fits your needs and your future. So thanks for taking the time to watch this. I hope it's going to make sense for you. Maybe it'll make a huge difference for you. I know that with people I've talked to already, they have saved anywhere from several $100 a month to over $1,000 a month just in the monthly premiums. And so again, individual, family, if you're healthy, and again, remember this for seniors, no pre-existing conditions at all. You got Medicare Part A and B, you get in there, and it's probably going to be right at the same price as mine. It's about $96 a month, but you can go on the site and check it, and I'll put that link in there. So thanks for listening. Dan from Michigan here again.